So today there are 29 new cases of COVID-19 to report, and this comprises 23 new confirmed cases and 6 probable cases. There are no additional deaths to report. However, we do have 14 people in hospital, and that includes 4 in ICU. They are in North Shore, Middlemore, Dunedin and Wellington regional hospitals. We now have 317 reported cases of COVID-19 we can confirm have recovered. That's an increase of 35 on yesterday. So today's number of recovered cases at 35 is higher than the number of new cases at 29. And the combined new total of confirmed and probable cases is 1,239. For the cases we have information on, we've still got the strong link to overseas travel, 41% of cases. That continues to decline. 44% are contacts of other cases in New Zealand and 2% are community transmission. 13% of cases are still under investigation. We still have the 12 significant clusters, and the 3 largest are at Matamata with 64 cases, the Bluff Wedding with 87, and the Marist College cluster with 84 cases. In terms of laboratory testing, yesterday there were 3,990 tests processed, and the total number of tests undertaken to date has increased accordingly. I'll just find the correct number there. So our 7-day rolling average of tests is 3,547 per day. We still have good test capacity, and that continues to increase as supplies come in as expected this week. Just a quick word on the clusters. We've talked about those a little yesterday. We do take a particular interest there because when we have a cluster, either in a place, geographical place, or at an event, or in a particular location like a workplace or a school, there is the potential for quite rapid spread there. And our intention is then to try and ring-fence those clusters as quickly as possible and stop any further spread. So we do know that our ability to contain those clusters has been greatly enhanced because we are in the alert level 4 lockdown situation. So we're confident now that we are on top of those clusters and that any additional cases are largely within bubbles within each of those clusters. We've also worked to streamline information flows between the district health boards, ourselves and ESR to ensure we're able to get on top of those clusters, to contain them, to get good information about the timing of the onset of symptoms and of diagnosis of new cases, and also the proportion of close contacts that we are successfully tracing. And just to help sort of reassure me about that contact tracing system, I've asked infectious diseases specialist Dr. Aisha Varel to do a rapid review of that today. I'm meeting with her later in the day and look forward to getting her views on how robust our process is and whether there are any improvements we could make to it. And finally, just on flu vaccination, we've now distributed over 1 million doses of the vaccine around the motu. They are in general practices, pharmacies and in district health boards. There are good supplies in every region. I have looked at the figures. We have sufficient vaccine for all our priority groups, and I encourage those people to call their GP or their pharmacy and make a time to go in and be vaccinated. And Associate Minister, Health Minister Julianne Genter announced earlier today we are extending for 2 weeks out to the end of April the time for those priority groups to be vaccinated, and those who are not in priority groups just to wait until after that time to get their vaccination. And finally, please, if you have any health conditions that you require care for, either acute care or you have a chronic condition that requires care, you contact your usual healthcare provider or talk to Healthline if it's an acute condition. We really want people to keep showing up for and seeking care that they need and not delaying care so that they end up being worse off. So that's all I have to say. Prime Minister, back to you.
Thank you, Ashley. Today is day 15 of Alert Level 4 lockdown, and at this rough halfway mark, I have no hesitation saying that what New Zealanders have done over the last 2 weeks is huge. In the face of the greatest threat to human health that we have faced in over a century, Kiwis have quietly and collectively implemented a nationwide wall of defence. You are breaking the chain of transmission, and you did it for each other. As a government, we have had pandemic notices. We've had powers that come with being in a national emergency. But you held the greatest power of all. You made the decision that together we could protect one another, and you have. You have saved lives. Modelling provided to my office by economist Rodney Jones on the eve of the lockdown suggested New Zealand was on a similar trajectory to potentially Italy or even Spain, and that our 205 cases on the 25th of March could have grown to over 10,000 by now, without the actions we have taken together. And new modelling, due to be released later this afternoon by Te Pūnaha Matatini, suggests that the current controls at Alert Level 4 have already had a significant impact on new case numbers, and we are on track to meet their most optimistic scenario. Instead of the horrific scenes we've seen abroad, we are at 1,239 cases, and the total number of cases has fallen for the last 4 days, was, as Dr. Bloomfield said, just 29 cases today. The lowest daily number of cases since the 23rd of March before the lockdown began. We are turning a corner, and your commitment means our plan is working. But to succeed, we need it to keep working. Success does not mean we change the course. Removing restrictions now would allow the virus to spread rapidly once again, and we would be back to the starting line within 2 weeks. That's also why we will keep enforcing the rules. In addition, you will have seen an increase in police enforcement in recent days. I expect that to continue, including roadblocks in some places this Easter weekend. While most are doing the right thing, some are not. We cannot let the selfish actions of a few set us back, and we won't, especially after all that everyone has sacrificed to get us here. I've read messages from those who have lost loved ones that couldn't come together to grieve for them. I've read stories of brand new parents whose most joyful time has been made so difficult because of separation. Businesses who are worried for their livelihoods and for the family that are their employees. I am acutely aware of the pain many New Zealanders are feeling. Over 1 million of our fellow citizens are now supported by a wage subsidy, many of whom will be experiencing a cut in income. At the end of March, there were already an extra 4,866 Kiwis on a benefit, and last week that number increased by another 10,000. Many businesses are also reporting that they may not be able to reopen at the end of the lockdown. I want to give you all the assurance that I can that the health and well-being of you and our communities has always been on our minds as we have made decisions on COVID-19. But so has your livelihoods. We will continue to stand alongside you. We've made record investments to keep as many businesses as possible afloat and people in jobs. We're doing what we can to cushion the blow and plan for our recovery. But as I've said, this is going to be a marathon. Our plan for that marathon is to keep eliminating the virus from New Zealand. We can do that by keeping it out of the country, but also by rapidly stamping out any outbreaks that flare up. And that plan is the very best thing that we can do for the New Zealand economy. The best economic response continues to be a strong health response. And that's why I'm announcing the next stage of initiatives to scale up our health response to put us in the best possible position to exit level 4 and prepare for level 3. No matter what level we are at in the future, there are 3 areas where we need to become watertight. Firstly, our borders must be tightly managed. That's why from midnight tonight, every New Zealander boarding a flight to return home will be required to undergo quarantine or what we have called managed isolation in an approved facility for a minimum of 14 days. I'm also signalling that the requirement for 14 days of quarantine or managed self-isolation in a government-approved facility will be a prerequisite for anyone entering the country in order to keep the virus out. As an island nation, we have a distinct advantage in our ability to eliminate the virus, but our borders are also our biggest risk. As a government, we have gone harder earlier with border measures compared to other countries. But even one person slipping through the cracks and bringing the virus in can see an explosion in cases, as we have observed with some of our biggest clusters. The quarantining of returning New Zealanders will be a significant undertaking. For context, nearly 40,000 New Zealanders have returned home since the 20th of March, when we closed the border to foreign nationals. That is more than all of the hotel rooms across the country that we could have properly housed people in. There has always been urgency around this matter, but simply put, we could not have done it from the beginning. But we can and are doing it now. A network of up to 18 hotels will be used to implement this approach, of which 1 to 2 will be specifically set aside for those under strict quarantine conditions. And just as a reminder, those are for those travellers who are symptomatic or are being tested for Covid-19. The second aspect of our ongoing COVID response is significantly scaled up and faster contact tracing and greater use of technology. The more we move to improve the speed and effectiveness of our contact tracing, the better place we will be in breaking the chain of transmission. The Ministry of Health is already working on a locally developed app that will assist with contact tracing. I should caution that it is in the early stages. It will have basic functionality, but even that will be important as it will help update our national health database with users' contact details. Then they will look to add functions. We are investigating the Singaporean government's Bluetooth-based app Trace Together that can record interactions between a phone and any other phones nearby that have the app installed. I should caution, though, that it will often pick up phones at quite a distance, so it's not perfect technology. The data is stored on the phone, and if the user tests positive, they then release the data to the government for contact tracing. Close contacts can then be automatically notified if they need to self-isolate and be tested. Singapore are planning to open source their technology in the next few weeks. We have made initial contact with the Singaporean government and registered our interest. And I have a phone call with Prime Minister Lee of Singapore this evening where I'll be discussing this technology further. I do again think it's important to note that these kinds of apps are useful, but they don't solve everything. What's most important is that you have good people and enough people working on contact tracing as quickly as possible. We do, and we continue to improve and work to improve every day, as Dr. Bloomfield has set out. And finally, this ongoing plan must be underpinned by testing. We already have incredibly high rates of testing compared to others, but we want to be even better. We will be maintaining high levels of testing and supplementing it with additional testing to ensure we have greater levels of certainty around the decline in the virus's spread. With these three pillars, border controls, rigorous testing and contact tracing, and making sure, of course, that we use all the technology available, we have what we need to win this marathon. But I know in a race it's important to have signposts, to know where we are and exactly what we need to do when we get there so we can all have a plan. Let me set out some of the timelines then for some key decisions that will affect everyone. Level 4 has come with some heavy restrictions. That has required difficult decisions around services and businesses that can and cannot operate. We need to give similar detailed guidance on what life at Level 3 looks like, and we will do that next week. That will give us a window to iron out questions and issues and make sure we're as prepared as we can be when it comes time to eventually move. It is then my intention that on the 20th of April, 2 days before the lockdown is due to finish, Cabinet will make a decision on our next steps. That's because we need to use the most up-to-date data that we have to make that decision. That means if we are ready to move to Alert Level 3, Business will have 2 days to implement arrangements. But let me say again, we will not be moving out of level 4 early. If we move too early, we will go backwards. In the meantime, I ask every business to use the time you have to prepare for what every alert level means for you. Treat COVID-19 like a health and safety issue. Ask whether it's possible for your business to operate with social distancing. Can you build in contact tracing tools or mechanisms to keep track of your supply chain and customers? Help us get ready as a nation for the marathon that we must run together. I do know that we can do this, and I know that because we are already. So as we head into Easter, I say thank you to you and your bubble. You have stayed calm, you've been strong, you've saved lives, and now we just need to keep going.